This is Rachel. I'm so excited to be able to see all of you. Well, actually, guess not see everybody, but talk to everybody. This is going to be our live childbirth class. I'm going to give everybody a minute just to get acquainted with the program for YouTube. So YouTube classes are great. This is Rachel, by the way. This is my 8 steps to a prepared childbirth program. I know that I'm going to give everybody just a minute to log on, but this is a great class. We're going to go over childbirth. We're going to go over breastfeeding, mommy care, baby care, pain management. So a little bit of everything in this wonderful class. If you ever have questions or you need to even have a copy of the PowerPoint, you can always contact me by text or just let me know by email, mommydidyouknow@gmail.com. Or you can even text me as well, 954-471-6934. My information is also on the caption itself. So if you have any questions, you can always let me know. And there's also the class calendar on the description as well. So you can always see additional classes as we have them. So to start off, like I said, my name is Rachel. It's so nice to see everybody. And I know that with COVID, there's not many childbirth classes out there. So I'm very excited that you can at least start your journey with me. It has been a long process with me. This was me with my second born, Nathan. I'm a maternity nurse. I also teach childbirth classes at the hospital, along with private ones that I do, such as this one. And it's a great way for moms to be prepared as they step into labor and the postpartum period, especially. Now, I always start off with pregnancy and understanding your body. And especially in the first trimester, what you'll see is that you'll have some morning sickness, frequent urination. I always was really surprised by the fact that you have frequent urination in the first trimester as well, because I always thought it was because the baby's big, but it's all that extra fluid in there that your body is starting to change. Usually with that second trimester, you get a little bit more of a second wind. And then with that third trimester, you might have some aching back, pelvis, nasal congestion, all that good stuff. So for those of you who are here, you also can do the live chat. If you see on the there's like a thumbs up, there's a live chat, share, all of that. You also can let me know if you have any questions by putting them in the live chat. And then especially towards the end of your pregnancy, for me, I always had a little bit of nasal congestion was for me, but if you guys had any especially if you had like nausea or sciatica. I had a lot of sciatica. I remember that especially as I was like going down to do fundal checks, all of a sudden I would get like sharp pains coming up from kind of where my pelvis was all the way up. And then I had to wear support bands and binders. I had to also wear compression stockings to help with those as well. So that helped definitely. And then for me, I also had a lot of nausea. So after each section, we're also going to have a little review to see how you can overcome different things. So for me, I had a lot of nausea, and then that seems to be a pretty well-known thing too. So one thing that you can do to overcome nausea is by having small, frequent meals instead of large meals. You can also try to stay away from the greasy, fatty foods. You can also try to, sometimes the B vitamins, like they really help to negate that emesis that you have. And if you have any triggers, like for me, I found that it especially was the greasy foods. I had to kind of stay away from those triggers so that I didn't have them. And then for preparation, especially before you're coming into your childbirth and before you're coming into your delivery, make sure that you're prepared. You can always remember the power of your words. I always try to remind my patients that, or even my family before they're coming into delivery or they're pregnant. And your words have this ability to really affect how your body works. So remember that so many times, especially as a nurse, I'll have a patient that, let's say they first get the baby and they're just sitting there and they're like, oh, I don't know if I can do this. And they get kind of discouraged and they start having these negativity. But make sure that you have a positive support system. If you tend to have people that are a little bit negative or a little bit more negative, make sure that you kind of are very very open with them, honest with them, say, you know, this is more of what I need right now at this moment. And just to remain that positivity, try to keep the negative talk to a minimum, try to keep those negative emotions at bay. You really want to make sure that you have a positive support system, especially as you progress through your pregnancy and your labor. And then don't neglect what gives you joy. You know, if you love music, listen to music. If you go to church, keep going to church. If you're a member of a book club, you know, keep reading those books. One thing that I noticed with me was that I had postpartum depression, especially with my second. I didn't have it as much, but with my first, I did have some postpartum depression. And I was thinking to myself, why was I getting postpartum depression? What was going on to kind of make me feel so down? And then I realized it was because of the dynamics and the changes that take place as you are, you know, going from no baby and you're involved in everything. And then all of a sudden the baby comes and the dynamics change. And I was very involved with the music, for example. And then once I had the baby, I no longer was really involved with the music because I was kind of stepping back with the baby. So I kind of had to manage myself so that I can really keep everything that I was going, keep the momentum. So although you don't have to be as involved as before, the dynamics change a little bit. But, you know, if you're part of a book club, you might not be going as often, but maybe you can go virtually, or maybe you can continue, you know, reading those books. If you love music, maybe you can continue to be involved with the music in whatever way that you can, and try not to neglect what gives you joy. And you can start keeping those even while you're pregnant, so that even after you have the baby, you already are in that mindset. And then keep your support system close. Especially try to keep your family and your support team close to you. Be open with their wishes regarding your labor, delivery, and your child care. That is a huge one, especially after you have a baby, because sometimes, especially if your support team starts to kind of wean out of your life, sometimes it can cause a little bit of a depression. So you want to have this mental preparation before you're having the baby, so that you remember, okay, I'm going to keep my support system close. I'm going to be open with my family, and that will really help to really be open with your labor, delivery, childcare, really everything. And then I have this question here. How do you overcome the fear of being a first-time mom? So I get this a lot, and my answer when it comes to overcoming the fear of being a first-time mom is try to prepare ahead of time, keep your support system close, and also remember that it's okay not to have all the answers, and it's okay not to be perfect, because everybody's always going to have questions about things. And in the long run, a lot of the things that people are really nervous about is not really going to make such a big difference as you think. Like, if you don't hold the baby exactly in the right position, it's not going to be the end of the world. If you don't listen to the exact Mozart version that you were thinking that you would be listening to, it's not going to be the end of the world. So I think one big thing is try to take the burden that's on your shoulders, and try to keep that burden off. Try to just relax. And sometimes that makes a huge difference in and of itself, just being relaxed. And then we have our section about labor and delivery, which is step 3. So we talked about pregnancy. We talked about preparing mentally, and now we're going into labor and delivery and how the body progresses through childbirth. Now, a lot of people always ask me, what are the differences between true labor and false labor? Now, there's many different ways that you can tell if something's true labor versus false labor. The most important one is that true labor does not really go away when you rest or if you are drinking water. False labor, on the other hand, it's usually also if you are, having those practice contractions. If you rest, you drink some water, they usually at least decrease in intensity a little bit. Another one is that your true labor is usually very regular in frequency, meaning that It might be far away, it might be close together. However, they are very regular. It might be every 15 minutes, every 10 minutes, every 5 minutes, every 3. So they're regular, although they can be, 30 minutes apart, but they're still regular. And that's kind of the biggest deal with true labor, is that they are regular. Braxton Hicks not necessarily will be far apart. That's another kind of common misconception that moms have, is they think that Braxton Hicks have to be far apart, and that if they're close together, they must be in true labor. But in a matter of fact, sometimes your Braxton Hicks can be very close together, but they are not regular in frequency. So you might have one 10 minutes, then one 15 minutes, then one 5 minutes. And then you're going, oh no, my contractions are 5 minutes apart, but it was just that one. And then it comes again, 10 minutes, and then 5 minutes, and 15 minutes. So it's not very regular. And that's one huge way. A lot of times I'll have people ask me, especially my clients, and they'll say, oh, I don't know if I'm in labor. And I go through the checklist, and if the checklist is all done, then you're probably in labor. But real labor, true labor, is regular in intensity, regular in frequency. It's strong in intensity. It does not go away when you start resting or you start drinking water. And it's also very strong compared to false labor. When you even feel your belly, you'll feel it very hard, almost like the feeling of your forehead and how hard your forehead is. True labor is very, very strong like that as well. Not to be expected, especially as you get closer to delivery, can be lightning. Lightning is when your baby is starting to engage in the pelvis and you start to feel kind of this lightning surge come up from your pelvis. Now, when you notice that, sometimes people feel it kind of consistently as there's more pressure on the pelvis, and some people just feel it, once or twice, and then that's it. Everybody's different. Another one is bloody show. Bloody show, or even your mucus plug. A big thing with that is if your cervix is dilating, there's usually this little mucus plug that is in between as the cervix is together. Now, as your cervix dilates, sometimes that mucus plug starts to be dislodged, meaning you're having some sort of cervical dilation. So that does mean that your childbirth is probably coming closer, that your labor is coming closer. However, that does not necessarily mean that you are in true labor. And especially as a nurse, although it's nice to know if you have your bloody show or if you have a mucus plug that was released, however, that does not necessarily mean that you are in true labor. So sometimes it's more information that we don't really need that much. Because if you think about it, your cervix can be dilating for quite some time before you actually get into labor. With both of my kids, I started dilating at 36 weeks. I was not in labor at all. So that's another thing that a lot of people don't realize, is that just because you're dilating does not mean you're in active labor. Early labor can be from 1 to 3 centimeters dilated. So that's just your body starting to get used to it. I was in early labor, or that starting of the dilation, even from 36 weeks, my cervix was already like 75% effaced, like 75% soft. It already was 1 centimeter dilated. I remember with my second, I was 2 centimeters dilated. And I'm like, oh man, gotta put a break on this. But both of them, I ended up having them right around 39 weeks. So you can start having your bloody show. You can start even releasing your mucus plug. You can even start having some mild contractions, but that does not necessarily mean that you are in true labor. Water breaking, of course, would mean that you are heading towards true labor, especially. However, not everybody starts breaking their water before they labor. It's another thing that, thanks to the movies, it's kind of a common misconception that people are walking through the grocery store or they're in a baby shower, then all of a sudden their water breaks. Sometimes the water breaks in the initiation or the start of labor, but more time than anything, it's actually breaking when you're closer to the delivery itself. Now, a few things that's really important about your water breaking. Number one is make sure that if your water does break, that you pay attention to the consistency of the water and the color. So that's a huge thing. If your water is not clear, make sure that you're paying attention to what color the water is. So if it is black, for example, or if there is a green tinge to it, you want to make sure to let your doctor know, because those can all be signs of distress in the baby. So normally, even though your water breaks, you don't necessarily need to go to the hospital right away. You can still take a shower. You can still, go about your business, especially if it's your first baby. However, if your water breaks and your water has a weird looking color to it, then that is when you would want to go straight to the hospital, and you would want to let them know, hey, my water broke and it looked this way. The only difference is if it is bloody tinged. Sometimes the water might look blood tinged, and that can be okay. We'll probably make note on it on your file, but it's not going to mean like a respiratory distress, such as if we had meconium stained fluid, which is when it has that darker kind of green looking or even black looking, because that meconium stained fluid can mean respiratory distress or some type of distress that's going on in the baby. So we want to make sure we're paying attention to the color, and we're paying attention also to the smell. It should not have much of a smell. If it has a smell like a foul odor, that can mean infection. So we want to make sure that you head to the doctor right away, that you head to the OB or the doctor's office, well, actually not the doctor's office, the ER, because you would want to make sure that you get that checked into, especially if you have an infection and your water breaks. Your water is like this protective membrane for the baby, so that if your water breaks and you might have an infection, any bacteria can easily swim up to the baby and cause an infection for the baby. So in that case, they would start on antibiotics for mom while she's in labor. And then after she has the baby, they'll determine how bad the case is to see if the baby will need to be transferred to the NICU or not. So expected, lightning, bloody show, water breaking. We're looking at the color. We're looking at the smell for the water. Also note the time too, because once your water breaks, you have about 18 hours before you want to head to the hospital. So when your water breaks, if you have more than 18 hours with your water breaking, your baby's at an increased risk of infection. So that is a big thing you want to look for as well. So you want to, if your water breaks, the color, the smell, and the time, just because especially if you have more than 18 hours of rupture time, your baby's at an increased risk of infection. We also have nesting. So nesting is to be expected before you deliver. What you'll notice is, I don't know about you, but for me, I felt like I was nesting pretty much my entire pregnancy. But then especially as I started to get closer towards my delivery time, my nesting instinct was in overdrive, where I started like seeing how everything was according to months, and I was organizing everything according to months. But what you'll notice is before you'll have your baby, especially before you go into active labor, you're going to notice your nesting kind of in overdrive. So that's another way that you can tell, okay, this might be, I'm heading into labor. And then of course you have your regular contractions, and then the ring of fire. So that is going from active labor to transitional labor until finally pushing is when you're going to have that ring of fire. And that's pretty much the baby's crowning or coming out. And that's pretty much what it feels like. You're going to feel like a lot of pressure as the baby comes out. What I noticed for me, the head was the hardest part. And then once the head came out, it was just like, that's literally what it felt like for me. Like once the head came out, the rest of it was easy. You just feel a little bit more contractions as well after the placenta, for the placenta to come out as well. So you have lightning, bloody show, water breaking. You want to keep the color, the smell, and the time in check. You have your nesting instinct, which will get a lot more intense before you have the baby. Regular intense contractions that don't go away with resting, don't go away with water. You also have your ring of fire. Now for complications, I like to go over as well, just because when there's complications in pregnancy or in complications during labor, I know that a lot of moms freak out. So I want you to see kind of what all these complications are and what we'll probably be doing as well. And this is true for both the hospital and the birthing center. So number one is abnormal heart rate. So a lot of times the baby's heart rate will start to drop in response to, let's say, there's a placental insufficiency, there's not enough oxygen going to the baby. That can be because maybe mom's not managing her pain effectively, maybe the way mom's positioned, or it can even be from, let's say, the cord around the neck, that there's a little bit of difficulty getting oxygen to the baby. That's when usually if the heart rate starts to drop, they'll turn mommy to the side. They'll also try to stop the Pitocin or at least slow it down. because when that Pitocin is causing those contractions, what happens is those contractions, every time you're getting a contraction, it's causing a temporary decrease in blood flow to the placenta. And then as that happens, you get that temporary decrease in blood flow to the placenta and to the baby. Of course, baby's oxygen level is going to go down. And as baby's oxygen levels go down, so does the heart rate. So that's why sometimes they're going to slower stop the Pitocin, going to put mommy to the side. There might even give mommy oxygen. And those are all different ways that they'll hopefully get the heart rate back up. And then if the heart rate is not getting back up, then that's when they might even talk about surgical removal of the baby, like if they were going to have to do a cesarean birth or something like that. We also have laceration. So after the baby comes, there's a difference between an episiotomy and natural tearing. So you can keep that in mind. Episiotomy is a surgical incision that either is mom's decision or we have to do for emergency. Let's say the baby's too big. Sometimes they have to cut to open the vaginal area more. And there's also natural tearing, anywhere from 1 first-degree tear up into a 4th-degree tear. First degree is just a little superficial tearing. 4th degree is like cutting all the way across. So that can be pretty uncomfortable, as you can imagine. Episiotomy is usually hurts a little bit more than natural tearing. So keep that in mind because it's something that they don't really tell you. However, episiotomy heals quicker than natural tearing just because it's not jagged such as tearing naturally. So you kind of have pros and cons that you can measure when you're making your informed decision because just like with anything, you can make informed decisions. You can make informed decisions about your Pitocin. You can make informed decisions about episiotomy versus natural tearing. Pretty much everything that's in your medical care, you have the right to have a voice and an opinion in that. So make sure that you are voicing yourself when appropriate as well. You also have failure to progress if the baby is not coming down for whatever reason. That one, a lot of the times, can be managed by breathing. You also have shoulder dystocia, which is when baby gets stuck. So hopefully, if that does happen, we'll have to kind of put some pressure to get the baby out. Also, umbilical cord issues is especially if the cord is around the neck or you have malpresentation as well, is when the baby is having, let's say not head first, let's say the baby's bottom first or to the side. And then how do you know the difference between true and false labor? The difference is true labor is very consistent. It's regular in the consistency. It's also very intense. It's a lot more intense. So you're going to notice it's regular in the frequency. It's more intense. False labor, on the other hand, it's very usually can go away with resting or go away with water compared to true labor. And then true labor, you usually can't really talk through it too much either. And then labor and delivery, how to understand the exams and treatments. And I know that there's a lot of exams and treatments during labor and delivery. Number one, so there are a lot of maternal tests. So the biggest one to look into is CBC. That's your complete blood count. That's going to be like your hemoglobin levels, hematocrit. You also have rubella. With all of those, especially the biggest one we're looking for is the CBC, which is that complete blood count. We want to make sure that mom's not anemic, such as if the hemoglobin was low, or white blood count. We want to make sure that the white blood cells are not too high because that can be a sign of infection. So normally they'll do a CBC before you have the baby and they'll do another CBC after. The rest of those labs they'll probably get with your prenatal history. Same thing with also hepatitis B, GBS. The biggest thing with GBS is that if you are GBS positive, you want to make sure to have treatment during your pregnancy, because if you don't, it can end up causing an infection for the baby as well. And for those of you who don't know, GBS is a naturally occurring bacteria that a lot of women have. However, if babies get it, it can cause a really bad infection for babies. So if mommy is GBS positive, we normally want to have at least 2 doses of antibiotics for mommy. That will definitely help to to cover the baby so that they don't have that infection. And then we have PIH labs are for moms for hypertension especially, and vaginal exams. And we'll usually do vaginal exams if mom comes in for labor, or if she's coming in for an induction. Sometimes we'll do the vaginal exam if mom says that, you know, her water broke as well, although we try not to do vaginal exams too much after the water has broken, because that can be an infection risk as well. And then for tests for baby, there's like a sepsis workup for infection, glucose screen for sugars, bilirubin tests as well, that test for jaundice, the yellowing of the skin. There's also infant screening and cord blood profiles that test for the blood type. Normally for blood type, we only really test the blood type if mom's O or if she's negative. O mostly to see if there might be a blood incompatibility between mom and baby's blood, or negative to see if mom needs something called ROGAM. Just gonna drink some water. And then how does being GBS positive make a difference in terms of labor? So for GBS positive, the biggest thing is that you want to make sure that you have enough antibiotic treatments during your labor to cover you and the baby, which is usually at least 2 doses of ampicillin. And then once you do have the baby, if there's any signs of respiratory distress, you definitely want to let your doctor know. And then the different pain relief methods for childbirth. So there's the non-pharmacological pain relief methods, such as Lamaze, which is breathing techniques. So really simple breathing treatments that you can do. For example, you can pick a focal point, such as a clock or a spot on the wall or something along those lines. And what you can do is breathe in through your nose 3, out through your mouth 3. So in, 2, 3. Out, 2, 3, while you're picking a focal point. And another thing you can do is also pick different parts of your body. So let's say you pick your arm, then you pick your legs. And sometimes when you pick different parts of your body, it helps to focus the pain from one part of the body to another part of the body. There's also acupuncture or pressure points, such as over here or over here. And when you have pressure points, and whatever pressure points that you are having will help to progress your labor as well. You also have water birth that helps to kind of keep the gravity off of you, and it also helps so that you can move a little bit more. You also have meditation, such as hypnobirthing, and gentle delayed pushing, where you're waiting to push until you actually are ready to push. Then you also have pain relief methods. Nitrous oxide is laughing gas. Sometimes they might still use it in birthing centers, but I usually will use in the hospital local anesthesia, especially in the vaginal area when baby's coming. If you don't want to really feel that much as the baby's crowning, sometimes they might have local lidocaine, just a lidocaine injection. You also have IV pain medications, such as Demerol or Nubane. The only thing with those is sometimes they make you a little loopy. So that's the biggest thing with those. You also have an epidural. Epidural is a spinal block. So it's a nerve block, that usually wears off about 1 to 2 hours after they take it out. You also have spinal anesthesia, which normally lasts about 6 to 8 hours after, and that's usually what they'll use for C-sections. And then general is when they put you like pretty much completely under. And then for labor pains, how can you manage labor pains? So the biggest thing for me is that you are using a wide variety of different management techniques, that you're always not using the same one, because that's one thing is a lot of people will use the same labor pain technique for only one, and then if one of them's not working, they're like, all right, now I'm stuck. So you can use a wide variety of techniques. So you can use, for example, you can use, let's say you're using Lamaze, you can be breathing, and then at the same time as you're breathing, you can be having someone to massage to kind of help with the acupuncture part of it. And then as you're managing that way, that will definitely help, because you're using a wide variety of different techniques. You can have positive affirmation, hypnobirthing. That's like especially positive affirmation flashcards, where you're where you have the flashcards and you're thinking to yourself, all right, I can do this. I will see my baby. You have guided imagery. So the best way to manage labor pains is simply by having multiple different ways at the same time and kind of mixing them all together. And then for how to take care of yourself after delivery. So a few different things to look forward to after you have a baby. One of them is contractions. You also have mood swings, period-like bleeding called lochia, and even shaking. Shaking because of the difference of the fluid. You also might have contractions, especially afterwards. And with every baby, the contractions are always a little bit more intense. You also have mood swings. So especially after that placenta is gone, because that placenta was like a hormone factory. So the placenta leaves and so does all those hormones. So sometimes you're going to have a little bit of those mood swings. Period-like bleeding, especially that lochia is going to be kind of bright and red in the beginning, and then it's going to get less and less and less as time goes on. You also have complications such as hemorrhage, high blood pressure, sepsis, and depression. So hemorrhage is bleeding too much. And the best way that you can kind of see if bleeding is too much, one is by the pad itself. So you should not have, like, let's say you go to change your pads. If you go back an hour later and your pads are saturated again, that's too heavy bleeding. If you, let's say you're sitting in bed and you get up, you might have little blood clots coming out. But if you have blood clots the size of your fist or greater, that is definitely a sign for concern as well. Then you also have high blood pressure, which is definitely something that you want to look out for, especially even after delivery, because a lot of people will look for it during pregnancy, but not necessarily during delivery. But high blood pressure can be devastating after delivery as well. Signs of that can be dizziness, can be swelling of the hands and feet, even sometimes blurred vision, headaches as well. Sepsis is infection. Usually that is controlled by antibiotics, and you'll have like a fever for that. Sometimes you might even be really lethargic. And then you have depression, which is another complication. And the way that you can tell depression versus baby blues is depression is usually very debilitating and it lasts longer. Baby blues are kind of short-lived and you can still, get about the day. And those are the biggest differences. And then for postpartum care, one of the biggest things that I want to go over is perineal tearing and how to handle the pain. So for perineal tearing and pain with perineal tears, one thing that you can do is Tux pads, dermaplast spray, SIDS baths. Those really work to kind of ease up the pain in the perineal area, especially after if you have like an episiotomy, for example, and it's really painful. You can always try side lying positions, like, this lady's kind of side lying. So side lying positions, Tux pads, dermaplast spray. You can even use the peri bottle and that they give you in the hospital, or you can even buy them on Amazon, and you can fill them with warm water, and you can even spray at the same time that you're peeing, and that can help with perineal pain and burning, especially when you're peeing. And then once the baby comes out, now there's some normals and then there's some red flags. So behavior changes for babies. Usually in the beginning, babies are very active for the first few hours. Then they start to kind of hibernate on you for about 12 to 24 hours. And then they have especially this kind of party time where they just wake up and they make up for lost time. So with babies, in the beginning, especially that first hour to 4 hours, you want to try skin to skin time. After that, you want to wake them up every 2 to 3 hours to nurse or to eat. And then, so especially that right at delivery, they're usually very active. Then they're very sleepy, especially that first day. Then that second night, they start to really wake up and they start to cluster feed, and you want to try to have as much skin to skin time as possible. They're going to have kind of this waxy, cheesy-like substance around their skin called vernix. That's a natural moisturizer, natural insulator for the baby. So normally we'll want to wait to bathe the baby until about 24 hours after the baby's birth, just to give them some time to transition. And then you might even see a little bit of newborn rashes, especially because baby's skin is very irritated in the beginning. And then also you might have a baby have noisy breathing. However, they should not really be that rapid. So keep that in mind. You might have noisy breathing, but it would not be over 60 times per minute. Over 60 times per minute is a little too fast. Normally it's about 30 to 60 times per minute is average. And then you also have your soft spots, or your soft fontanelles that's here on the skull. If they're flat, that's normal. However, if they are depressed like this or they're sunken, that can be a sign of dehydration. And then for breathing, if you see retractions, that's when they're using their accessory muscles to breathe. Or baby's very lethargic, not waking up for feeds. Those are all reasons to call the doctor. Fever, 100.5 or above, or tachypnea when the baby's breathing over 60 times per minute. And then signs of respiratory distress can be like nasal flaring. It can be changes in the colors of the skin. It can be labored breathing, especially. Another one is tachypnea, like we were mentioning before. And then if your baby has any signs of respiratory distress, you would want to really make sure that you go to the hospital as soon as you can. And then feeding babies. Now, this is just a really basic a flow of how to feed babies. But so this is a really basic crash course. Hope you've been liking it so far. So for feeding methods, for direct breastfeeding, and I'm just going to give you a few tips for each one. So for direct breastfeeding, make sure that baby is skin to skin with you, at least in the beginning, belly to belly, and that the baby is wide over the breast, not just over the nipple, but over the breast as well as the areola, about 140-degree wide angle of the mouth, and make sure that both of the lips are flanged out also. So you would want to, for direct breastfeeding, belly to belly, mouth over the nipple and the areola, and make sure that you are bringing baby to the breast, not the breast to the baby. You also have donor milk if you need. You have the Milk Bank Association of the America. You can also look for other methods as well, but you can always use donor milk. You can also pump. So let's say baby's not nursing or you prefer to pump, you can always try pumping for the stimulation, at least until your milk supply starts to regulate and baby's latching out a little bit more. You can always give expressed milk through the pump. And then if you are doing that, your expressed pumping schedule should be similar to a breastfeeding schedule, in which your pumping should be about every 3 hours, just like a baby. And your pumping session should be about 15 minutes if you're exclusive pumping. And you want to make sure that you're really compressing the breast, that you are actively pumping at the same time. Make sure your phalanges are the right size. And some people do some direct breastfeeding and some expressed milk. So some people do a little breast in a little bottle. If you are one of those that do a little breast in a little bottle, for the breastfeeding, it's always put the baby to the breast first, and then whatever bottle that you have, you can always use that and give to the baby. And then same if you are doing expressed milk in formula or putting the baby to the breast in formula, you always offer, let's say some people do breast milk, expressed milk, and then formula. You would do the direct breast milk first, then you would do the express milk, and then the formula, unless baby tends to drink the whole bottle, because sometimes you can end up using all of the, let's say, otherwise you'll end up drinking the formula but not drinking the express breast milk. So that's what you have looking forward to. And then another one's all formula. If you are doing all formula, you want to make sure that you're checking your expiration dates for the formula, and you're making sure that you're shaking it as well to get all of that good stuff that's kind of on the bottom and get it all the way around. And then make sure you're not overfeeding the baby as well by knowing the difference between feeding cues versus sleeping cues. And when you do feed bottles, make sure the baby's more upright rather than slanted down, but upright, and the bottle more parallel to the floor, kind of like a paced bottle feed. And that way you'll get a little bit less gas and air trapped in there. I hope you liked this class, and you can always, comment below if you have any other questions for me, and you can sign up for other classes on the description, or you can always contact me for other information that you might have. Yet again, I really hope that you enjoyed this class. You can always subscribe, comment below as well if you have any questions.